Lesson 14. Sexuality, intimacy, and closeness in schizophrenia. Sexuality is a natural part of human life, regardless of illness, age, or life situation. It gives a sense of closeness, joy, bonding, and bodily safety. And yet in schizophrenia it is one of the most neglected areas. Many people avoid talking about sexuality because they feel shame, embarrassment, or fear of being judged. Loved ones often stay silent, therapists rarely raise the topic, and the person with the illness is left alone with it, not knowing whether their experiences are normal or part of the illness. In reality, the sexuality of people living with schizophrenia is just as varied as the sexuality of people without the illness, but it goes through its own stages: withdrawal after an episode, changes in libido caused by medication, a more difficult relationship with one's body, fear of rejection, and sometimes, on the contrary, a strong need for closeness driven by loneliness. All of this lies within the natural spectrum of experience, and your reactions are more understandable than you might think. How antipsychotics affect libido. After a paranoid episode, sexuality very often changes. For many people, this is a source of anxiety. The body behaves differently, sensations are weaker, arousal comes more slowly or not at all, and reactions that used to feel natural now seem distant. It is important to know that this is a completely natural, fully predictable phenomenon described in the medical literature. It is not a defect of personality or a character trait, but the effect of biological processes taking place in the brain and the entire nervous system during recovery. After an episode, the body functions similarly to how it does after a very serious physical illness. First, it has to slow down in order to rebuild its balance. A brain that has been working in a heightened alarm state for a long time enters a phase of slowing once the psychosis subsides. This slowing affects thoughts, emotions, energy, and sexual responses. In this phase, the body operates cautiously, conserving resources and focusing on the most basic functions. Libido naturally drops because the body is setting its priorities on regaining psychological stability. Antipsychotics, the medications that stabilize your condition, also play a major role in this process. Their action is essential to prevent paranoid relapses and restore balance to the mind. However, by acting where excessive dopaminergic activity needs to be calmed, they also affect those areas of the brain that are responsible for arousal, pleasure, and spontaneity. Dopamine is a neurotransmitter linked not only to delusions, but also to drive and sexuality. When medications lower its activity to a safe level, the body responds with reduced energy, weaker arousal, a longer response time, and decreased sensitivity to stimuli. Another element is the rise in prolactin levels that occurs with many antipsychotics. Prolactin is a hormone that naturally inhibits sexuality, and it does so independently of your will. Elevated prolactin can weaken the intensity of sensations, reduce spontaneous arousal, make it harder to reach orgasm, and affect the body's physiological responses. This is one of the most common causes of sexual difficulties in psychiatric treatment, and at the same time one of the most reversible. When medication doses are stabilized and treatment has continued for a longer time, prolactin levels often return to normal and the body's natural sexual response returns with them. We also cannot ignore the sedative effect that appears especially at the beginning of treatment. Many antipsychotic medications have sedating properties. They quieten, induce sleep, and slow you down. Sedation works like a heavy blanket that gradually covers the excess arousal. Unfortunately, it also covers the energy that drives sexuality. In such a state, the body focuses primarily on rest rather than on closeness. All these mechanisms together, biological exhaustion after the episode, the effect on dopamine, increased prolactin, and the sedative action, create a picture of sexuality that is muted, slowed, or weakened. This is a completely natural reaction of the body during recovery. And what is very important, it is a temporary reaction. In most people, libido returns once the medication doses have been reduced to a maintenance level and the brain has regained metabolic balance. This process can be slow, but it is well known and predictable. The most important thing is to remember, these changes say nothing about you, your worth, or your attractiveness. They are not a sign that something is wrong with you. They are the result of medications that are there to protect your mind, and at the same time the effect of a regeneration phase that is one of the healthiest stages after a psychotic episode. Your body has not refused to cooperate, it is simply resting. When it regains its strength, its natural capacity for closeness will return as well. Sexuality in a relationship. Sexuality in relationships where one person lives with schizophrenia often requires a new sensitivity and a new language. The illness brings changes in the body, in emotions, and in psychological balance, so both you and your partner may feel uncertain, afraid, or embarrassed. Many couples stay silent about sexuality because they fear being hurt or rejected. Meanwhile, closeness during recovery is like a delicate plant. It does require care, but it can grow back stronger than before if it is given the right conditions. The first of these conditions is emotional safety. Sexuality cannot be a continuation of tension or an attempt to escape from problems. It needs to grow out of the feeling that you can be yourself with the other person even if your body responds more slowly and your mind is more tired. This is why couples therapists emphasize that conversations about sexuality should begin with a simple statement of fact: right now my body responds differently, I need more time and calm. Such clarity removes many unnecessary assumptions and fears from the space between you. Your partner stops wondering whether they have done something wrong, and you stop worrying that you have to fake a readiness you do not currently feel. Many partners initially interpret sexual changes as a sign of coldness or lack of interest. They do not know that what they see is a physiological response to medication and a natural phase of regeneration after an episode. Their misunderstanding does not come from ill will but from lack of experience. When you gently explain that your reactions are not directed against them, but are a side effect of treatment, relationships often see a sense of relief and new empathy. This is why manuals on schizophrenia recommend, whenever possible, that partners take part in psychoeducation. Knowledge reduces fear, and less fear means less tension. Closeness does not have to look the same as it did before the illness. Sexuality is not only intercourse, it is also touch, warmth, sleeping together, subtle gestures, and quietly being side by side. Many couples rebuild their intimacy based on these gentler elements. It often turns out that they become the foundation of trust. During convalescence, the body responds more slowly and emotions are more easily fatigued, so pressure, haste or the expectation of a quick return to the old form can create tension that effectively blocks arousal. Closeness built slowly, in an atmosphere of acceptance and gentleness, allows sexuality to return at the body's natural pace. It is worth remembering that couples therapy places particular emphasis on communication. This does not mean hours of talking about problems, but short, clear signals. Today I need more quiet. I would like you to be near me. Your touch helps me calm down. Such sentences create a climate in which your partner knows how to support you. It is equally important not to be afraid of setting boundaries. If your mind is overloaded, you have every right to say no to sexual contact without feeling guilty. Healthy sexuality cannot be built on pressure or coercion from either side. Sometimes your partner has their own fears. They worry that closeness might make your condition worse, that the illness has destroyed your sex life, that they will have to watch every move. In such cases, it may help to reassure them that sexuality is a natural part of human life and that as long as closeness does not cause stress, it is safe. If tension does appear, you can pause and return to a calmer form of contact. Sex is not an exam. It is a shared experience that can be postponed if either of you is not ready. In many relationships, solo sexuality also plays a role. Some people need a period in which they explore their own body and learn new responses before resuming sexual closeness with a partner. This is normal and does not have to be seen as a threat to the relationship. In sexual therapy manuals, it is even said that getting to know your own reactions and needs is a stage that makes later communication with a partner easier. The better you understand what works for you and at what pace you want to build intimacy, the easier it will be to invite your partner into that space. The crucial thing is that sexuality in a relationship during remission does not have to return to what it was before. It can become deeper, calmer, and more mindful. Many couples find that the illness has taught them a different kind of closeness, more conscious, less driven by impulse, and more grounded in presence and empathy. If you both allow for patience and mutual gentleness, sexuality will return at a pace that is right for both of you. There is no need to rush. What is needed is trust that your bodies and your relationship know how to find themselves again. Risky sexual behavior during an episode. During a psychotic episode, some people engage in sexual behaviors that would never even occur to them under normal circumstances. These may be impulsive decisions, casual encounters, sex with strangers, or behaviors that go against their previous lifestyle, values, or morality. Many people, once they have regained stability, say the same words, "That wasn't me." And in a very real sense, it wasn't your healthy mind, nor your true decisions. Psychiatry describes these behaviors as a natural consequence of disordered thinking, elevated dopamine, and the breakdown of control mechanisms during the psychotic phase. In an episode, there are serious disturbances in assessing risk, boundaries, consequences, and social norms. The mind functions as if it were detached from your usual identity. It is not your values that are guiding your decisions, but a pathological state that distorts everything: thoughts, desires, context, sense of safety, and the moral rules that normally apply. In the recovery period, becoming aware of these actions can give rise to deep shame, guilt, fear of judgment and painful questions. How could I do that? What is wrong with me? In reality, the truth is entirely different. You did not fail. The illness took over the controls. Your behavior from that time is like the symptoms of high fever, delirium, or severe intoxication. It is the result of illness, not an expression of your personality. The greatest relief comes from understanding the mechanism. During psychosis, dopamine rises to a level that disrupts judgment and the ability to inhibit impulses. In this state, a person is not guided by his or her own beliefs or principles. They are not acting as me, but as someone cut off from their usual norms and emotional filters. For this reason, the way you behaved during the episode says nothing about your morality, character, or worth. It does not testify about you, it testifies about the illness. But how do you cope with what you remember? Therapists emphasize that the key is to separate yourself from the symptoms. You can clearly tell yourself, that was behavior under the influence of illness. It is not part of my nature. This perspective does not erase the memories, but it puts them in their proper place. Eastern spiritual traditions, including Buddhism, teach that actions arising from a state of confusion do not carry karmic burden, because they are not fully conscious. The same applies in therapy. Actions taken in psychosis are not a moral choice, but a consequence of a disorder. Sometimes it is helpful to discuss this with your psychiatrist or psychotherapist. That gives you the chance to sort out your emotions and to understand that you are not alone. Such behaviors are widely known and described, and professionals do not judge them, they help you make sense of them. You can also talk about it with your partner, but only if you feel that the relationship has enough stability and mutual trust. The conversation needs to be handled gently and should not turn into self-accusation, rather into an explanation that these were actions arising from psychosis, not from your intention. Interestingly, clinical experience shows that partners most often do not treat such acts as betrayal, do not make scenes, do not reproach, and do not blame. The prevailing view is instead that a partner in a state of temporary incapacity was ruthlessly sexually exploited. The most important thing is that you do not punish yourself for something for which you are not responsible. In schizophrenia, an episode takes away a person's control over behavior in the same way that fever takes away clarity of thought. It is over. You are coming back to yourself. You have the right to make peace with your past and to create a future in which you can love, be loved, and rebuild your sense of dignity on new, healthier foundations. Changes in appearance during pharmacotherapy, how to regain a sense of attractiveness. Many people starting treatment for schizophrenia notice changes in their appearance over time: weight gain, puffier facial features, heavier eyelids, reduced facial expression, and sometimes changes in skin texture or a slight swelling of the whole body. These are phenomena widely known and described in psychiatry. They do not result from neglect or the loss of attractiveness, but from the biological action of the medications, from mechanisms that are there to save your mind and stabilize the chemical processes in your brain. The most common change is weight gain. It results from several overlapping factors. Antipsychotics alter glucose metabolism, affect how energy is stored, increase appetite, or change the way the body responds to hunger and satiety. Some medications also disrupt insulin regulation, which makes the body store reserves more quickly. This is not a matter of weak will or gluttony, it is a metabolic reaction. The body receives the signal that it must store energy because it is in a phase of intensive recovery. The expression of the face also changes. Some antipsychotics dampen the activity of the facial muscles, giving the face a calmer, sometimes slightly clouded expression. In psychiatry, this is called affective flattening. However, it is not permanent. Facial expressiveness returns as the brain relearns how to express emotions once neurotransmitter activity has stabilized. Facial or body swelling, if present, usually results from water retention and from the medication's impact on the hormonal system, including prolactin and cortisol. The skin may become more delicate, more prone to chafing or discoloration, which is also a described side effect of pharmacotherapy and usually subsides once treatment is stabilized or the drug is changed. These changes can affect your sense of attractiveness. You look in the mirror and see someone who doesn't look like they used to. Sadness, grief, a sense of losing your former identity, and even fear of intimacy often appear. It is important to know that these feelings are completely natural. Anyone whose body undergoes visible changes, regardless of their cause, experiences similar emotions. This is not vanity, but a healthy psychological reaction to a transformation in appearance. The key thing is to understand that changes in appearance are not final. In many people, weight stabilizes after a few months, facial expressiveness returns when doses are adjusted, and swelling subsides after a medication change or as metabolism improves. During convalescence, the body needs more care and patience. Gently introducing physical activity, making light adjustments to the diet, regulating sleep according to medical advice, and avoiding excessive stress can all be helpful. Together, these elements support a metabolism that works more slowly under antipsychotics, but is not broken. The second pillar of regaining a sense of attractiveness is psychological work. Appearance changes throughout life, with age, illness, joys, and losses. It does not define our worth. And in schizophrenia, there is an additional important layer. The body changes because it is defending your mental health. The external effects are the price paid for inner stability. In a sense, they are the marks of your courage, evidence that you have survived something most people cannot even imagine. Many people find peace when they look at their body with gratitude. You endured all of this. Thank you for protecting me. This attitude does not erase the changes in appearance, but it changes the way you experience them. And that is what makes the greatest difference. When we treat the body with respect and gentleness, we regain trust in it, and in turn we regain a sense of our own attractiveness. It is also worth talking about this with your partner or therapist. Many people are afraid to say, "I feel worse in my body," but when they do, they receive more support than they expected. Closeness is not built on a perfect appearance, but on honesty, compassion, and mutual understanding. Your partner does not see you through the lens of your weight or facial expression. They see you as the person they love and whose story matters to them. The most important thing is to remember, your attractiveness has not disappeared. Only the form has changed, not the essence. Your body is undergoing treatment just as your mind is. And just like the mind, it can regain balance. The crucial thing is that you do not turn away from yourself. You are the closest person you will have for your entire life. This relationship is worth nurturing, even when your appearance is going through a more difficult time. It is also worth remembering that you do not have to cope with all of this on your own. If the weight gain is rapid, hard to control, or leaves you feeling overwhelmed, a consultation with a dietitian can be very helpful. A specialist can adapt an eating plan to your abilities, current treatment, and energy level. Modern dietetics is well acquainted with the specifics of antipsychotic therapy and can suggest solutions that are neither restrictive nor exhausting, while still helping you slowly regain a sense of control over your body. Such a consultation is not a sign of weakness, but of self-care. It is a step towards regaining balance, calm, healthy, and fully in line with the treatment process. Avoiding toxic relationships. During a psychotic episode or in the months immediately after it, the mind is particularly vulnerable to misreading emotional signals. At this time, you may feel an intense need for closeness or a desperate search for support, and, at the same time, paradoxically, your ability to assess other people's intentions is weakened. This is a very dangerous combination. In such moments, it is easy to mistake brief attention for love, politeness for genuine interest, and someone's curiosity for commitment. It is even easier to trust someone who is not worthy of that trust. In the psychiatric literature, this is described as an affective distortion of relationships, a state in which emotions are too intense, too impulsive, or too quickly turn into fixed beliefs. A person with the illness may believe that someone is meant for them, that they picked up the same signal, that they feel the same, when in reality this is simply the effect of the illness and altered brain chemistry. In this period, it is extremely easy to enter into a relationship that seems beautiful and profound, but is actually based on illusions or on emotions that will fade once your condition improves. This state can also make it harder to notice warning signs, lack of respect, manipulation, sexual pressure, financial exploitation, abuse of trust, or being pulled very quickly into a relationship. The other person, not always consciously, may be taking advantage of your vulnerability, of your longing to be loved, of your loneliness, or of your temporary psychological weakness. Such a relationship is not love. It is a dependency that deepens the illness, undermines your sense of safety, and often ends in another episode. The key thing is to understand that during illness your capacity to accurately judge a partner is biologically impaired. This is not a character flaw or naivety. It is a symptom of the illness, just as real as hallucinations or delusions. For this reason, most professionals strongly advise against getting involved in new romantic relationships when your mental state is unstable. The heart may be longing for closeness, but the mind is not a tool you can safely rely on at that time. If someone appears who seems like the perfect partner, who very quickly shows intense interest, who wants closeness right away, or who puts you under pressure, it is worth being especially cautious. Some people are drawn to another person's weakness because it allows them to feel more important, stronger, or more needed. Others seek control. Still others take advantage materially, emotionally, or sexually. A person with mental illness is much more exposed in these situations to being hurt and often even exploited. The best protection is time, distance, and consultation with someone you trust, a long-term partner, a family member, a therapist, or your doctor. Emotionally healthy people can evaluate a relationship much more clearly. This is not a form of control, it is a form of care. Just as after major surgery you avoid lifting heavy weights, during recovery from an episode you should avoid emotional risks. Only when your condition is stable and your symptoms are under control can you consciously assess whether a relationship is good for you, whether it brings peace, whether it is based on mutual respect, and whether your partner treats you as an equal person, not as someone dependent on them. True love begins where the other person does not speed you up, does not push, does not play on your vulnerabilities, and does not exploit your sensitivity, but instead gives you time, space, and freedom. Illness does not take away your right to love. It only takes away your ability to recognize love safely during an episode. As you return to balance, your ability to judge people and situations returns as well. And then you can choose a relationship that truly strengthens you instead of hurting you. Summary. Sexuality during recovery from a schizophrenic episode is an area that calls for patience, gentleness, and understanding. Both body and mind go through many changes, biological and emotional, so sexual responses may be weaker, slower, or simply different from before. Antipsychotics quieten arousal, alter metabolism, and affect hormones, which naturally influences libido and appearance. These are not permanent changes or signs that you have lost your attractiveness, but rather part of a treatment process in which your body is protecting your stability. During this time, it is important to allow yourself a break from pressure, to treat your body with care, and to gradually regain balance. At the same time, it is crucial to build sexuality on honesty and safety. Talking with your partner, setting boundaries, accepting a different pace, and avoiding toxic, risky relationships are key elements in rebuilding intimacy. During illness, the mind easily confuses fascination with love and the need for support with genuine affection, which is why it is better to avoid sudden, intense relationships formed in a state of instability. True closeness returns when balance returns, along with your ability to choose a partner wisely. Sexuality in remission can be calmer, more mature, and more conscious than it was before the illness if you allow yourself time, caution, and kindness toward your own body.